Radiology is, they call it now like diagnostic imaging, and there's different techniques you can do to image a person to figure out what's going on with them. There's, the regular x-ray, there's ultrasound, CAT scan, MRI, mammography, and then there's also like fluoroscopy and interventional radiology, which are other fields within radiology. I'm considered like the doctor's doctor, and I help make the diagnoses so that the doctors know how to take care of their patients. We, as a radiologist, look at the images, figure out if there's an abnormality, a disease process, and we generate a report and send it to the doctor. I read out of a hospital with an emergency room as well as 4 offices, so there's different caliber of patients that come in the door, anywhere from someone who just broke their finger to gunshot wounds. When COVID-19 came, it was like a whole new disease process that we knew nothing about. Typically, the things we see are everyday cases, and once in a while you'll come across a rare entity that you can do a literature search and even find case reports on this topic. But when COVID was first coming out, we knew nothing about it, so it was actually difficult to make the diagnosis. And a lot of times we would just maybe describe the findings we've seen on the chest x-ray, and over time, like over the course of a month or two, and with all the data on the internet, we started to realize certain patterns were emerging. For example, a bacterial pneumonia usually presents with like one area, a very dense consolidation on the chest x-ray, whereas COVID is hazy, so it's not as dense, it's more peripheral, it's more nodular, it's more asymmetric, bilateral, and diffuse. So the pattern is very different. So now I'm pretty confident when I call a COVID on a chest x-ray, whereas before that, I would probably just describe the findings and say the appearance is concerning for pneumonia. Now I would say the appearance is concerning for COVID pneumonia. If you come in the ER, or you go to an urgent care because you feel like you're sick, they'll test you for COVID and they'll get a chest x-ray. And just because a chest x-ray might be normal, that doesn't mean you don't have COVID. So it's really the COVID test. But if you have an abnormality on the chest x-ray, the prognosis is worse because now you've got really what's considered COVID pneumonia, and it's in your lungs. And what I've been seeing is it takes a long time for these infiltrates to go away. It's not like you have it one day and the next day is gone. It could be weeks before they go away. And there are many people who get very, very sick, and they end up on respirators in the ICU, and they stay on the respirators for a long time. Because this is a new disease, there's lots of side effects that we didn't even know could arise, and one of them is vascular. Patients with COVID, they tend to get coagulopathies, and they end up with blood clots. So they end up with DVT in their legs, which is thrombus in the veins in their legs, thrombus in their upper arms, and then it could dislodge and go to their heart, which then goes to their lungs, and they end up with a pulmonary embolus, and you can die immediately from that. So now in the hospital, all the COVID patients, they get screening ultrasounds of their legs and their arms every couple days just to make sure that they're not getting these blood clots. And then besides that, people end up with vascular issues and neurologic issues. I've seen a woman who was a COVID patient in the hospital for a while, like over a month, and she had like an encephalitis, which is an infection of her brain that they felt was caused by the COVID. Even though you yourself, if you're young and you catch COVID, chances are you're going to be fine, but that doesn't mean you're not going to spread it to someone who is immunocompromised, have health conditions, or who are elderly, and those are the people who are going to succumb to this.